edition of Your Health Matters program. On today's edition, I have a guest with me. Can you please introduce yourself, Doctor?
Hi, I'm Olumide Otoya, a consultant geriatrician that is a specialist that deals with caring for older people, a physician. And I'm also an associate medical director at the North East London Foundation Trust.
Thank
Thank
you.
you very much, Labake.
Thank you so much. So that's actually our guest for today, Dr. Olumide Adeotoye. I really appreciate. Thank you so much. Because of this ongoing pandemic, obviously, COVID is not a new thing to every one of us. But there are new developments in terms of vaccine was introduced at some stage, and there are a lot of questions around this vaccine. People have doubts. We have watched a lot of videos online. Some people are saying it's not good for the black minorities. People are shaking. Some people even say don't take this. Don't. They want to use it at they want to use it to reduce the population. So your girl Lavake is that I thought, you know what? Let's actually get somebody who has enough knowledge to come and tell us. So Dr. Olumide, how many type of vaccination do we have in UK? And please, can you tell us the difference between these two
Okay.
vaccination?
Now, before I say anything, I just want to make some declarations. One, I've had both jabs. Two, I have no shares in any of the pharmaceutical companies. So I'll put that out there. Right. In the UK, we have three types of vaccines that have been approved for use.
Okay.
There are generally three different types of vaccines worldwide, and we are using just two of those types. There are the mRNA vaccines, and those are the messenger RNA vaccines. An example of those are the Pfizer vaccine and the Moderna vaccine, and both of those are approved in the UK. The second type of vaccine is, and I'll explain a bit more about that, is
Sure.
the virus vector vaccine. And an example of that is the Oxford AstraZeneca vaccine, which is the third vaccine that is approved in the UK. The third major type of vaccine is the inactivated virus vaccine. That is not approved in the UK, but it's being trialed, I think, in China and India, but it's not approved in the UK. So just to recap, in the UK, we have three vaccines that are being used: the Pfizer, the Moderna, and the Oxford AstraZeneca. The Pfizer and Moderna are messenger RNA vaccines, and they need to be stored at very, very cold temperatures. Pfizer minus 70 degrees centigrade, Moderna minus 20 degrees centigrade. The Oxford AstraZeneca is a virus vector. So the vaccine is put into a modified virus that cannot infect, but is introduced into the body by injection. And that can be stored in your ordinary fridge. And that is why you will find that in the community where they may not have access to super cold fridges, they are more likely to use the Oxford AstraZeneca vaccine. But in the hospitals where they may have the facilities to store, they may use the Pfizer or the Moderna vaccine.
Oh,
So
thank you
that's
so
how
much.
it goes with the vaccine.
Thank you so much. So, you've actually just explained that I was going to ask the type of vaccination in UK and the difference. So, what is the difference? You've actually so what is the difference? Because people are thinking, so does it mean one is actually more better than the other? So, but what's the
Not
difference?
necessarily so. It's about technology. There's
Okay.
been a lot of fear around messenger RNA or mRNA technology. It's not new. It's been around for at least 10 years, and they've been working on them. So the fears around, oh, this was done too quickly, is not really a real fear. It's a perceived fear. If you watched the BBC Panorama program on the Oxford vaccine, you will find out that they already had the software, and all they needed was the genome, the DNA of the virus, and all they needed to do was feed it into a computer and come up with the goods. So the efficacy, the effectiveness of the vaccines is high, but they're not the same. So in the trials done by the companies themselves, the Oxford and the Pfizer and the Moderna virus were about 95% effective. The Oxford AstraZeneca was between 70 and 90% effective. So they're all highly effective. And to put this into context, the flu jab that we have every year is roughly about 55% effective. So they're much more effective than the flu jabs that we have every year.
Okay. That's actually understandable. So can this vaccine protect us from having COVID? So for instance, I've had the first dose. I'm still waiting for the second dose. So for all my viewers, I've had the vaccine and I shared my experience on Facebook. So does it mean that if I've taken the vaccine now, does it mean I'm protected? I can't contact COVID.
Okay, so as I said earlier, they're between 70 and 95% effective. In
Okay.
fact, the Pfizer vaccine in Israeli studies was found to be over 99% effective. Now, there's a caveat here. This assumes, at least in the Pfizer vaccine, that you've taken both doses within 3 weeks. So if you
Okay.
do that, you will have over 99% effectiveness. What that means is that 99 out of 100 people will be protected, but one person may still have um, COVID-19. In the other ones, 95%, 95 out of 100 are protected. 5 people may still catch COVID. But the evidence would suggest that in anybody that has been vaccinated, even if they catch COVID, they're very unlikely to have the severe form of COVID-19 that will land them in ITU or that might threaten their lives. So
Oh.
even though it isn't 100% coverage, it does protect, it does provide effectiveness for everybody that has it.
So if I understand what you're saying, the fact that I've taken the vaccine doesn't mean I can still contact COVID.
It doesn't.
So, but it will only protect me.
Yes, it means that you shouldn't have the very severe form. Yeah,
Kind of makes sense. So,
yeah.
what can you tell us about this vaccine? Actually, before I go into mine, what information do you think the people, the masses, needs to know?
Okay. What I think they need to know is that one, they're safe. The trials done with the vaccines were about two things. One, safety, and two, effectiveness. They did enough to prove that they're safe. And since about 15 million people in the UK have had the vaccine, so there's no doubt that they're safe. Now, some people will have some side effects, such as fever, headaches, shivering, aches and pains, but they last 1 or 2 days, and usually they would respond to paracetamol. There is some evidence to suggest that if you've actually had COVID, you're more likely to have some effect following the vaccine. And if you've had it following the first jab, you may have it following the second jab. But then again, let's put it into some context here. Headache, fever, shivering, aches and pains versus being on ICU and a ventilator. Pick your choice.
Exactly. Thank you so much. I think that's actually well explained. So regarding to these videos we are seeing online that they want to use it to actually reduce the black minority ethnicity, what can you say about that? Is it safe, or why do we are they stage videos? What can you say about those thing?
Well, what I can say is I need to start with the fact that the vaccine is not compulsory.
Yeah,
Okay?
true.
You have the choice. But my advice to anybody is get the information. Get the information from the right sources, and then make up your own mind about whether you want to have the vaccine or not. There are a lot of videos out there, and I've actually stopped watching them because a lot of them are rubbish. Now, I would say stick to the known places, stick to the trusted sources, WHO, NHS, CDC. All these places are trusted places. Stick to those. If you're not sure, check out the person speaking. There's some people that say they're doctors and they're not actually doctors. But having said that, I have classmates that are doctors that are still disputing the effectiveness of the vaccine. So they are doctors. But I think it's important that if a doctor is making a comment, they should distinguish between a professional advice and a personal opinion. So people may have personal opinions, but we have to stick to the evidence. In terms of things like fertility, there is no evidence that it affects the fertility. And actually, there's a statement by the Royal College of Obstetrics and Gynecology about fertility and pregnancy and the COVID-19 vaccine. So don't believe me, go on the RCOG website, it's in the public domain, and check out their statements, their public statements on those two issues.
Thank you so much. So what the doctor is just saying that is safe for pregnancy, is confirmed safe from people who are even pregnant to take the vaccine.
I didn't quite say that. What I'm saying is that in the studies, some people were inadvertently pregnant and didn't suffer any ill consequences. But the advice is that don't get pregnant if you're going to take the vaccine. So there is no evidence one way or the other. So I'm not saying it, I'm not advising to have it if you're pregnant.
So there is no, we don't have people who are pregnant who are taking the vaccine yet.
People in the studies that took the vaccine and became pregnant or did not know they were pregnant because they did not suffer any effect. But the official advice is not to take in pregnancy. So I need to make that clear.
Oh, thank you so much. So what if there's this question that, because I have a lot of questions sent to the email, your Health Matters email, and people were asking for people who have a lot of physical health underlying problem like kidney, diabetics, high blood pressure. Is it safe for them, for people who have underlying physical health issues?
I would even go further than that. And I'd say that people with such conditions are at higher risk of having COVID-19, at higher risk of having severe COVID-19. And so they are the ones that would benefit the most from the COVID-19 vaccine.
So are you saying it won't interact with their medication? Because people are worried that they're taking quite a lot of medication, people with ulcer, it won't?
No, it won't interact. If you're worried and concerned, what the usual advice is that even up until the point when you present yourself for vaccination, you can still talk to the vaccinator and allay some of these things, and you can still change your mind. At that point. So even those that are skeptical or are anxious, if you're called, you can still go and you can tell them your anxieties and you can listen to their explanations. And if you're happy, go ahead. If you're not, you can still say no at that point. And perhaps there's a case, especially in people that have certain conditions or medications, they're a bit worried, you can actually go and speak, or ahead of time you can seek advice.
Thank you so much. So how do they book this vaccination? Do they wait to be called by the GP, or is there a particular website that people can actually go when they've made up their mind, Dr. Olumide?
There are two ways. There are some people that can book. For example, those of us that work in the NHS, we have access to portals that we can book. But most of the public will have to wait for their GPs to invite them or for them to receive invitations from the NHS centrally, unless they think that there's a specific reason why they need it ahead of time, in which case they can contact through the NHS website. But invitations will usually go out
Oh,
to the public.
thank you. Also, the other question I have here is okay, you've talked about the how safe it is for the BAME community, and also the other question is that is it safe? What about children? Because obviously kids have COVID as well. So
Yeah.
what about children? Any research on children at the moment?
The original studies were not done in children; they were done in adults, which is why at the moment the vaccines are not indicated in children. I think the cutoff is either 16 or 18.
Okay.
Uh, but they've just started, and it was on the news this evening. They've
Okay.
just started a trial in 16-year-olds to see the safety, but we expect it to be safe, and the effectiveness. So at the moment, children are only being given on the trial and not in the vaccination program.
Okay. So at this moment I'm actually going to open the line. If you have any question to ask Dr. Lumide, the number to call, can one of the admin please put the number on the Facebook? The number to call is 079 353 18757. So please, if you have any question about the COVID-19 vaccination, can you call now and ask your question? If you put your question to the Facebook, I might not be able to answer you. So this is the right time. You can also, wherever, any part of the country, you can call on the WhatsApp. You can call on the WhatsApp as well and call from Nigeria, from any part of the, if you have any question, you can call. You don't have to wait. So I was actually in a, while we wait for people to call in and ask the question, Dr. Limide, I was actually in a seminar a couple of days, and people were asking questions, and the same person sent the same question here, and they were actually talking about the Pfizer. Actually, I totally understand. You said people have choices. It's not mandatory. People can refuse not, but obviously we are saying it is safe. Do you want to consider taking the vaccine or having COVID and have to deal with the symptoms and the sickness that comes with it? But this woman was making reference to some issues that this Visa has been used at some time in Nigeria and is not safe. What can you say? Because now you're saying to me the Pfizer is actually more actually guaranteed when you've taken the 2 dose up to 99. We have a caller. We'll come back to the question. Hello, you're welcome on Earth Matters program.
Hello, good evening. Good evening, Elizabeth. Good evening, Dr. Lumidai.
Good evening.
Good evening.
Good evening. Yeah, I have more like should I say concern or okay. The issue is you've highlighted that it is not mandatory to take the vaccine, yeah. But I feel pressurized about this vaccine because with my from my perspective, um you've also identified, I'm not trying to be a basher here, but after identifying that after they taking the vaccine does not prevent one having COVID or does not prevent having COVID, and you're still prone to having being tested positive for COVID. However, it won't just be severe. And I just feel like I'm being pressurized by by the government, by my work, by the work, and everyone just kind of saying every now and then, "Oh, have you taken the vaccine yet? No, do you want to take the vaccine?"
Okay. Are you asking a question or are you
Yeah,
just commenting? What's the
more
question, please?
more like venting and a question because if
Okay.
this is if it is not mandatory, I don't think that it should be pounced on every, and it shouldn't be more like imposed like have you taken the vaccine? It should be more like, do you want to take the vaccine? And I should have the opportunity to say yes or no. But I feel like everyone is just, even the doctor, your doctor will send you an email, a text message, oh, yeah, you can book your vaccine. How are you sure I want to book a vaccine? So, and
Mm.
how, and I, all of, I think my thing is, what are the assurance that if one takes this vaccine, it is credible? And what are the impact? Because we've been hearing rumors as well about the uncertainty and unsafety of having this vaccine. So that's the question, and a little bit of ranting. Sorry about that.
Okay,
That's right.
thank you.
So,
I understand what you're saying. There's pressure on both sides. So there's pressure to have the vaccine, and there's also pressure from the anti-vaxxers that why are you having the vaccine? So there is pressure on both sides. Um, I suppose all I can say is that in the UK it is not compulsory, but there is pressure. And let me talk about myself as a healthcare professional. I suspect some of my patients may ask me, have you had the vaccine?
vaccine.
If they do, they'll say, okay, if you haven't had the vaccine, how come you're asking
Vaccine.
us to have the vaccine? That's one. Two, they'll say, don't you think that you have a professional
Obligation.
obligation to have the vaccine, if only to protect us from you? So that's a question they'll ask me. So there is that pressure on me already, although I don't have a problem with the vaccine. And I already had made up my mind that I was going to have the vaccine. The other pressure is that whether we like it or not, there are some countries that are going to insist that if you're going to visit their country, you have to provide evidence that you have the vaccine. And that is not going to be one, it's not going to be two, it's going to be a lot of the common countries that we visit. So although we are saying that it's not
Compulsory.
compulsory, the environment may make it seem as if it is. In terms of the safety of the vaccine, as I said earlier, in the UK, 15 million people, did I say 15 million? Yeah, 15.5 million people have had the first jab. Over 500,000 have had both jabs. And you can imagine in the UK, if there's a serious adverse incident, it will be on the news because the news, the press will carry it. Even when they had the two allergic reactions, it was on the press. So you can imagine if someone died as a result of a vaccine, it will be all over the press. So in our experience of 15.5 million first jabs, we haven't had a serious incident. Yes, we've had people that have had fever, headaches, aches and pains, and it's not uncommon, but it only lasts a short period of time, and usually within a couple of days they've recovered. But it's nothing like, take my word for it, COVID-19 is a horrible condition. It's an extremely horrible condition.
Thank you so much, caller. I think the caller. I have another caller on the line. Hello, you're welcome on today's program. Hello.
Hello, good evening.
Good evening. Can you talk a bit louder,
Can you
please?
hear me?
Yeah, I can hear you, but really, really far.
Just give me a minute.
Okay.
Can you hear me better now?
Yeah, a bit, yeah, clearer now. Welcome on today's program.
Okay, good evening, Dr. Olumide, and good evening, Labake.
Good evening, Dr. Layola.
Thank you. I've got a question for Dr. Olumide. Just picking on the comment about the COVID passport thing. I know there have been a lot of opinions about this, COVID passport and how it's going to create some sort of inequalities. Now, my question about that is this. If people are to have this COVID passport, does that mean that people are not going to be able to spread these viruses again, even if they have the vaccine, and when they travel, for public health perspective, there won't be any opportunity to spread the virus? Or what is the real sense, and what is the real idea behind having a COVID passport? Really, I just really want to understand that concept very, very well. If you can comment about that, please.
Yeah, that is a very valid question because, as you say, we don't have the strong evidence that the vaccines interrupt transmission. They may prevent you having the disease, but we don't have, and that evidence is still being collected. But at the end of the day, the countries are acting in what they think is the best interest of
Trust.
their own citizens. So it doesn't matter what we think, Spain will make their own decisions. The United States will make their own decisions. Italy or even the EU as a bloc will make their decisions, irrespective of what we think. And I agree with your sentiment there that what is approved that vaccinating will interrupt transmission. The only thing
Okay.
one can say is that perhaps if there are less cases, transmission will be lower on a UK basis. But how that affects travel, I don't know. But having said that, those of us that are old enough will remember in the past, in the 70s, when we used to get those very painful cholera, yellow fever, etc., smallpox vaccines to travel, and you needed
Yeah.
evidence. So,
Okay.
yeah, that it is what it is. That's all I can say.
Okay. Thank you. I think I've got a second question, just quickly.
Go ahead, please.
I just wanted to find out your take on the efficacy of this COVID vaccine on those who are immunocompromised, people who have immunocompromised status. Is there any valid trial to suggest that it is effective for them? And are they going to be able to take this vaccine? And are they going to be able to
Certainty. But
use the advantage?
I'm not aware that there's evidence around how effective the vaccines are in the immunocompromised. What I can say is that there is no fear that they will catch COVID-19 from the vaccines because the vaccines don't contain virus. So, but in terms of the effectiveness, I don't know whether there's a evidence base around how effective they are.
Okay. All right. Thank you very much.
Thank you so much.
Thank you.
Okay.
Thank you. Bye. So, before we move on to the next topic, the the caller before Dr. Laiwola actually said she's feeling pressurized in a way, and the government, the destiny. So it kind of, I'm gonna pick any call, we'll stop, and then we'll come back to it. Hello, welcome on today's program, Your Health Matters.
Yeah, good evening. My name is Caroline.
Hello, mommy. Welcome. Thanks for joining in.
Yeah, welcome.
Good
I just
evening,
want
ma.
to ask the good evening, sir. I just want to ask the doctor. It's very confusing. Yes, I'm going to take it eventually when it's my turn. But they're talking of Pfizer, they're talking of Oxford. So we don't even know people like us, but people like me. I'm not on the medical line. So when it's my turn, I go into the center. It's whatever they pop into my body, I will accept. That is one thing I'm so worried about. Which one shall I request it for? Because it's very confusing the way it's being said, even now online. Okay, Pfizer, Oxford, Nigeria, which one shall I take now?
I
So,
think you may not have much of a choice. It's possible to have a choice, but because you will be constrained by the vaccine that is available at the time and in the place where you're having the vaccine. Having said that, I don't think there's any. I remember when they initially talked about the vaccines, I must be very honest and say, I was thinking that, look, if I'm going to pick a vaccine, I'm going to go for the Oxford AstraZeneca because I thought it was nearer in technology to the old vaccines, but I ended up having Pfizer. But I don't think it matters much. They're all very effective. So I don't think you need to worry much about which vaccine. The likelihood is that you will have the second jab of whatever you had the first time. So it's not likely that there'll be a mixture. So if you start out with the Oxford, your second jab is likely to be the Oxford.
okay.
So I don't think you need
So
to worry about which jab it is. They're all quite effective.
thank you very, very much for that, Leonard. So
Okay, madam.
looking at it worldwide now, it's going to be occurring yearly, like we take flu jab every year. So they're going to pump this to us in our body again every year. It's going to be a yearly taking, isn't it?
We don't know for sure, but it is looking like the COVID-19 virus may behave like the flu virus. So it seems to change. And if that's the case, we may have epidemics like we do with the flu. It's not necessarily every year, but we may have epidemics which might necessitate a yearly booster jab. But we don't know yet. The evidence is not there yet. But I suspect before the end of this year, we will know.
Okay, sir. Last before the list, so I could give, because I did put my question down. I'm very concerned about my grandchildren. When I say I'm a grandmother to so many, and at this early age, popping things into their body, as a doctor, what do you think?
But Matt, I'd like to think that your grandchildren had their usual jabs. So the polio, the MMR, that we usually get.
Yes, they did.
Their vaccines too. I think we forget that vaccines have been around for over 100 years, and it's because of vaccines that we were able to eradicate some extremely nasty viral diseases like polio, like smallpox, yellow fever. So all these nasty diseases, it was because of global vaccination programs that we were able to eradicate them. So we've been pumping ourselves with these nasty things for about 100 or so odd years, and we're still standing. So, and actually, the vaccine technology has moved on so much so that the vaccines we use now are much, much cleaner than the vaccines we used to have in the 70s. And those of us that had them remember how sort of traumatic they were. For about a week or two after, you couldn't even lift the arm.
Okay. Okay, thank you. Because now, when we look at the whatever that is going on WhatsApp, as a grandmother of so many, some things on the WhatsApp, oh, it's going to make our children in future to be infected as a Jesus shall know me. What is all this? So, hearing from the doctors and for those that are working within the medical is well and sure that it's not going to make them infertile or make them barrenness in future. I'm very concerned about that
No, it
because
won't. There is no evidence of such. None of the vaccines I know lead to sterility. And
okay,
let's pause for a minute and let's remember that before vaccines, things like polio, measles, smallpox, yellow fever, they were major killers in the world. So I think we have a short memory, and perhaps the younger people don't have those memories. But these things, and in some parts of the world, some of these things are still major causes of illness. Not necessarily polio, yellow fever, and smallpox. Those are basically gone. But there are some other things that we could vaccinate against that are killing people in other parts of the world. So I think I don't think there's any evidence to substantiate those fears, and those are exactly what they are, fears.
okay, okay, thank you.
Before you go, mommy, let me quickly have this as well. You asked the question about you don't even know which one you're going to have. So there is confirmation that the visa is actually going to be given in the hospital. If you want the Oxford, that are actually when you get your link sent to your GP, you can ask them which one. Anywhere they send you to, there is a fixed vaccination that is assigned to that place. So whenever you get the link or text message from the GP, if it's going to be the hospital, it's only in the hospital that you can get the visa. Is actually when you go to the community, that's when you get the Oxford. So whenever you get the text message, you can ask them which vaccination are they giving you there.
Okay.
All right. Thank you so much for calling, ma.
But daddy didn't go to the general hospital. Daddy went to our community center. Daddy
Then
went with him.
he must have
And
asked the Oxford.
okay, thank you.
Thank you so much, ma'am. Bye.
Thank you.
So thank you. That was actually a very good one. You can actually call to ask your questions. Please, everyone, don't put questions on the Facebook. I can see a lot of comments on Facebook. You've got your phone calling, and Dr. Adeotoye is here to ask your question, because I'm not a medical practitioner. I'm only a nurse, okay? So now we still have the opportunity to, I think we have another caller. We'll take that. Hello, welcome on today's program, Your Health Matters.
Hello, good evening. My name is Ola. Can I first of all say well done to the presenter and to our guests? You do a very good job.
Thank you.
I think this is very, very important for our people, because this COVID is creating a lot of anxiety for people, and there's a lot of misinformation there. Just trying to alleviate the fear of people as opposed to what is going on the social media, saying all different kind of things. Myself, I've had the vaccine and it doesn't cause any problem. People talk about Visa and Oxford. When I went to get mine, I don't care. I don't care about which one I get. The first appointment I got was for Oxford, and I couldn't take it because of this second appointment, which I wouldn't be around at that time. So they recalculated it for me and said, okay, I should come back some other time. By the time I went through another link, and when I went for that one, it was by the time I had it. So I think it is necessary for people to consider it. It's not as bad or causing some damages like we see in social media. I've had it, nothing happens to me. I'm sure the presenter has had it as well. So a lot of people are having it. I think people should consider it, especially when you work with vulnerable people, when you have very vulnerable people at home, and even we don't know how long this will stay in the whole world, and you'll be traveling around.
Thank you, Ola. You've just made my job that bit easier. You want to take my place?
Thank you so much for sharing your experience. That was actually really helpful, because I was coming to the first caller to kind of reassure the first caller to say, for the first caller to say she's actually pressurized, I should guess that person is one of the frontliner then, because no one is giving the vaccine at this time except your NHS staff, or you're having direct contact with the community. So if you say this way, that since the COVID is still out there, and thank you Ola so much for sharing your experience. Now that we know that is actually still out there, even if not for the sake of those people you're working with, for your own safety, because trust me, we still attend to patients that has COVID. For people who tested positive, they still come for the injection at my clinic, and we can't say, oh no, I'm so sorry because I haven't got the vaccine, or because there's no excuse. We still have to give them the injection. So in a way, if you look at it at your own, protecting yourself, if you look at that way, even if not for yourself, even if you're not having contact now, it's still going. The COVID, like Ola said, is still ongoing. It's not like we have a fixed time that is actually to say at this time there won't be any COVID, then at least everyone is safe. So if you don't consider yourself, consider your family, the children. And to be honest, I have the Pfizer, and I shared my experience, but it was just for a day. And Ola, did you have any side effect when you had your jab?
I only have slight pain, that arm, that night, and I took paracetamol, and that was it.
Oh, you see, so what are we talking about? So like I said, it will look, because obviously NHS is trying to protect their staffs. They're trying to protect the patients as well, and obviously they're looking after the well-being of the staff, and that is why
I think if I just have to add to it, I want our listener, okay, to take this serious. Don't live in denial. I heard our guest saying it earlier on. This COVID is a horrible, horrible, illness. You don't want it. You don't even want it to happen to your enemy. Some people say, "Oh, is it real? Is it real?" Oh, yes, it is real. Please, it's better to be safe than to be sorry. This is different from flu. I'll encourage people to consider it. is happening. If you actually want to know it is real or not, just walk to any local hospital here and
Yeah.
there are now
Yeah.
amount of ambulance that troop into the emergency
Yeah.
department with people with COVID. When you see chest pain or palpitation or something like that, breathing problem, then you see that these are COVID patients. And it doesn't matter your age or whatever it is, it
Yeah.
happens. I've seen people, having it. It's horrible when you have a relative having it and you have to go and give that person food or water, and you cannot see that person. You have to leave food by the door. It's horrible. I will encourage people to have it. We don't want anyone to have it. We don't even want our enemy to have it. But the truth is, it's out there. Take the vaccine. Consider it. It's not the news that people are giving that when you have it, this happens to you and that happens to you. I've not had that experience from people. People have never shared that with me. I had it and I've never had it.
Thank you so much, Ola. Thank you so much for sharing your
Thank
experience.
you.
So, Dr. Adeotoye, you work in Queen's Hospital, isn't it?
Yeah. I
So,
do.
so that means you probably will be seeing patient with COVID. Can you share your experience, please?
It, it's quite varied. I mean, during the first surge, our observation was that the patients were older. They had significant comorbidity, i.e., they had other health conditions. But during this second surge, younger patients, I've seen 27-year-olds on oxygen, 40-year-olds, 50-year-olds, 60-year-olds. So the patients have been younger. So COVID doesn't care about your age. It cares less about your gender. It doesn't care whether you're rich or poor. It doesn't discriminate. And it's a horrible condition. Okay, people die. And
I was coming
but
to
there's
that.
a lot that can happen between being alive and dying. It can leave people very, very miserable after even recovering from the condition, in terms of things like breathlessness and things like fatigue. It's a horrible condition.
Thank you so much, Dr. Adete. I was actually coming to say, so does it mean you've seen people die from this COVID? So the number again is 07935 318757. We are rounding up, and like I said, if you have this is the opportunity to ask your question. I was talking about the first caller earlier on, so we keep having calls, and obviously I'm going to go back to it. So I understand where the caller is coming from, and to be honest, I people that works with me during the pandemic, even till date, at some point people were saying maybe I have OCD. I said, you know what, I would rather deal with OCD and than to have COVID. You know, at a point I was feeling so nervous and anxious. I have to wipe everything before I see. You can't touch where I'm sitting. You can't even come closer to me. I think we have a caller. Let's take this call. Hello.
Yeah, hello.
Welcome on today's program, Your Earth Matters.
Yeah, good evening. My name is Ben. Thank you. My question here is regarding this COVID vaccine.
Ben, please, can you reduce the volume of your radio or TV, please?
Okay.
Thank you.
Okay. My question here is regarding this vaccine. Most of these vaccines, I'm talking about concerning Africa.
Okay.
So there are so many proliferation of vaccines, and some of these vaccines are being sent to Africa, and many African leaders are interested in vaccines from different countries, like China, Russia, many of these. So how are we going to regulate all these vaccines? Whether if these vaccines are really authentic, they are clinically tried for use, because some of the vaccines are being shipped to Africa, and nobody is taking control of what kind of vaccine they are. So these are my worry and these are my concern. If the doctor can shed light on this, how the WHO and the CDC can regularize this vaccine that has been shipped to Africa. So this is just my question. Thank you.
Okay,
Thank
good
you.
evening, Ben. Thank you for asking that question. Are you in the UK or in Nigeria or Africa?
No, I'm in UK.
Okay.
Okay, fine. In the UK, all drugs, including vaccines, are regulated by MHRA. So they have to be approved and they can't be used unless they're approved. Now, regulation is down to the country's government. There is no global regulation. So in the US, it's the FDA. They have to approve. If they don't approve, you can't use it in that country. So, for example, Nigeria, it'll be NAFDAC, I suspect. But
Yeah.
Good to know.
it's up to NAFDAC to regulate. So any company will be happy to export any vaccine to any other country. So it's up to the recipient country to put in the regulation and the quality control of what they will allow into their own country. So yeah, so and that's all I can say. So yes, India, China, they'll all do their vaccines. They will do the studies because globally there are standards. But in terms of whether you can use it in a particular country, it's up to that country to put in the regulation and to approve its use. I don't know whether that answers your question.
Yeah, thank you, doctor. It's well
Okay.
explained. Thank you. Yeah,
Thank you so much, Ben, for calling. Thank you.
yeah,
Bye.
thank
So, as I was saying, I don't really blame the first caller, but my aim of doing this program is to actually encourage people. I will say I'm not pressurizing anyone, and I'm not putting and I'm not making it mandatory for anyone. I'm only talking from a nurse's point of view to say it's safer to take the vaccine. And trust me, when you go to take the vaccine anyway, they will make you sit down for 15 minutes to observe you. And those videos we were seeing, the reason why I don't believe those videos is that those kind of reaction should have happened immediately when they take the vaccine, according to research now. So even when after taking the vaccine, they will give you some papers, some leaflets to say in case if you actually have any side effects, in case you actually find yourself in any situation, call us immediately. And so far so good in UK, there is no cases of those kind of reaction that we've been seeing online. And look, social media is free. I can choose to make a video. I can choose to post anything. So people are just using that opportunity to actually do whatever they like. And like the doctor rightly said, get your information from the right sources, from the right people who can actually give you the right information you need. So I'm going to wrap up. Before we wrap up, I can only take one more call. The number to call once again is 079-3531-8757. So if you still want to ask any question, please call us. I think we have another caller. Hello, you're welcome on today's program, Your Earth Matters.
Good evening. Thank you for this program. I do appreciate you.
Thank you.
I just want to have a word with the doctor.
Good.
Because for this, I'm just going to regard the vaccine that is coming out now.
Okay.
A lot of people got anxiety because I see they are still giving the vaccine. A lot of people are still dying. So I just want to know because a lot of people reacted to it, which sometimes survive it, sometimes they don't survive it. And a lot of people now they are still doubting, they don't want to take it. But now, as the thing is going now, I think it's going to be restricted that if you are not taking the vaccine, maybe you are not going to get a job, even things to the doctor by traveling. So are they insisting people to take it for their own safety or they have the mission of taking it? Yeah.
Okay, doctor.
Okay, thank you very much. Now, in the UK, they will not be able to deny you a job because you haven't had the vaccine, because that would breach employment law.
Of course.
So it's not in the law. So if anybody is denied, the person would be able to take them to an employment tribunal. They can't deny you a job because you haven't taken the vaccine. In terms of travel, it's
Yes.
not down to the UK. So if you're traveling to Spain, it's Spanish law. So if
Yes.
Spain say in their own law that you need to have COVID-19 vaccine to enter our country, then it won't be the UK. If UK say in their own law that people traveling from another country to the UK have to have a vaccine, then it's the UK law around travel. So we cannot influence the laws in other countries. So that is that. So yes, there are pressures. The UK government have to do what they think is in the best interest of the public health. And that's why it's coming across as pressure, because they're trying to do what is in the best interest. In terms of deaths, I'm not
Yeah.
aware I'm not aware in the 15.5 million first jabs that there's been a single death associated with the vaccine. Yes, there are deaths associated with COVID-19, but don't forget that only a percentage of the population has been vaccinated yet. And it takes about 2 to 3 weeks for you to develop the immunity. So there's a time lag, but the deaths are coming down. And that is not only due to the vaccination, of course, that's also due to the lockdown measures too.
So does it make sense, Kola? Does it make sense? What
Yeah,
you said?
it is.
Okay.
It is. It really makes sense. Because sometimes I got a friend that told me that, oh, in my workplace now, they tell me you need to find if you don't want to take it, but I think if you don't take the vaccine, I think you're going to lose your job.
No,
You know?
that's actually not true. I think that's been clarified. Nobody's going to be forced out of any job because they're not taking the vaccine. So, and like you rightly said, it depends on where you're traveling to. And we cannot control the law of those countries. So even if UK decided to say today, anybody coming into UK, if they don't have the vaccine, it will not be actually, I don't think it will affect the citizen.
Okay.
So in as much as there is no general law in the world to say he has to, but at the moment, as of today, 16th of February 2021, there is no law, and I don't think there will be any law that will force anyone out of their employment. Even for the NHS staff, we NHS staff, nobody is forcing us to do anything. They're only they're just trying to kind of, I would say kind of employ us to kind of encourage, yeah, that's the right word, to kind of encourage or to see reasons why we should take it for our own safety and for the safety of the patients, for the service user, especially those older people that are at high risk. Because if I go to a patient's house and I have COVID already and I want to go and give the person injection, don't forget that even if I'm wearing gloves, you understand, even after anything, maybe I touch a place and the person later touched after I've washed my hand and everything. So one way or the other, they might have this thing, this virus. So it's for our own safety and for the people we are looking after. And if you look at your other people, not just for NHS staff, for people who are registered childminders, who are teachers, even the bus drivers, even the lorry, for people who are having direct contact, people who sells in McDonald's. Imagine somebody working in McDonald's that they're making your meal as COVID. For a day, do you know how many people will have it? Just for a day. Do you know how many people patronize the place? And do you know how many kids eat McDonald's in a day? So I think it's just for the safety of the old people. That's why they are trying to kind of push it to say, please consider taking it. Thank you so much. I think we need to call it a wrap. Thank you. So I'm actually going to stop. I'm not receiving any call for now. Thank you so much for everyone who has called on today's program. I really appreciate you. I really appreciate all those people on the Dignity radio station. I really appreciate everyone who's actually put their comments on Facebook. I know Dr. Olumide will take his time to go and read it and respond, because we have our people that will only, they won't call. They will only be on the Facebook to support the program. So I want to say a big thank you so much to Dr. Olumide, because I called him within a short period of time and he actually came in here and to support. Thank you so much. We probably will be having him more, because this program is all about, we discuss mental and physical health issue. So, but because we still having to deal with COVID, and we want people to, the more people that get this vaccination, the safer for all of us. So that is why I'm saying, putting my voice out there. And in this program, the totality, the brief summary of this program is, please consider taking it. I'm not saying you have to take it. It's going to still be down to your own decision. Like I said in my video, I've taken it. In a couple of weeks time, I'm going to take the second dose, and look at me, I am fine. So I thank everyone once again. My name remains Labake, also known as Elizabeth. And please don't forget, your Earth Matter is still showing on Ben TV, Scout Channel 195, every Mondays at 9 p.m. and every Thursdays at 9 a.m. So we're going to be showing all our videos. If you mix it, you can catch up on the Ben TV. Thank you everyone for today. Thank everyone who has contributed in one way or the other. I really appreciate you. So we'll see you next month. Thank you so much. Bye.
Bye.